When it comes to nursing, understanding the composition of a solution and the various components is essential for understanding medication mixtures. This can especially be applied for liquid dosage forms of medication and other suspensions.
There are two parts of a solution, the solute and the solvent. A solution is the particles that are being dissolved and the component present in the lower quantity. A solvent is the liquid that is dissolving the solute. The solvent is present in the higher quantity. Water is known as the universal solvent. A solution is a homogeneous mixture composed of two or more substances.
Any particle that can be dissolved has potential to be a solute, but its ability to be dissolved depends on the polarity of the solvent. A simple rule for predicting whether a specific solute would dissolve in a specific solvent is like dissolves like. So if a solute and solvent have the same polarity, the solute will be able to be dissolved.
For example, NaCl, table salt, can dissolve into hot water because they are both polar. It also works vice versa. Nonpolar solute dissolve in nonpolar solvents.
Another example is how octane, C8H18, would not dissolve and wouldn't make a solution with water, because octane is nonpolar, and as we already know, water is polar. In this photo, octane would be liquid A, and water would be liquid B, making the two liquids non-miscible. Non-miscible means that they are not able to mix, and if they were, they would be miscible.
Getting into the idea of medications, a solution is a homogeneous mixture of which one or more dissolved medications are evenly distributed into a liquid vehicle. The dissolved medications are the solutes, and the liquid vehicle is a solvent. A vehicle in medical terminology is an inactive substance that is combined with an active medication to facilitate administration. Vehicles can be water, water-miscible agents, and non-aqueous solutions.
In a liquid dosage form of medication, it consists of one or more active ingredients in a liquid vehicle, such as a solution, suspension, or emulsion. The drug can either be dissolved or suspended by very fine particles depending upon concentration. A suspension is a mixture of undissolved, very fine solid particles distributed through gas, solid, or in this case, a liquid. Suspensions of medications distributed in water are known as aqueous suspensions. Example of an oral suspension would be liquid Tylenol. An emulsion is when two or more liquids are undissolvable with each other. Medications that are topical is where most emulsion medications are found. An example of a solution in nursing is a parenteral solution, which is a sterile solution that is administered by a needle or catheter via injection or infusion, and it can be administered intravenously, IV, intramuscularly, IM, subcutaneously, SC, or intradermal, ID. An example of such parenteral solutions would be insulin or heparin.
The dosage of information for a suspension of medication is important in understanding the concentration of the medication. Concentration is the amount of solute present in a given amount of solvent. A dilute solution would be a little amount of solute and a large amount of solvent. A concentrated solution is a lot of solute and an amount of solvent. A saturated solution contains the maximum amount of dissolved solute, while an unsaturated solution contains less than the maximum of dissolved solute.
We are now going to show examples of various concentrations of solutions.
Shown here would be an example of a dilute solution because it contains very little solute inside of the solvent.
This example would be a concentrated solution because it contains a lot of solute in the solvent, but there is still potential for more solute.
This is an example of a saturated solution because it has the maximum amount of solute in the solvent. It almost did not mix, but after further mixing, it did dissolve and there isn't any room for extra solute.
Circling back to medication, as nurses, we encounter medications of these three types of solutions daily. We may see a medication diluted in saline, or we could even see a medication that is concentrated that is only administered intravenously.
Knowledge of solutions, mixtures, concentrations, and polarity can not only help us in the study of biochemistry, but also in our nursing practice, as we can see. We see numerous amounts of biochemistry skills that we use in our nursing practice.
We can apply how we learn to convert units in biochemistry to our practice of converting units in order to find correct dosages in practice. As we learned kilograms to pounds, we can find the correct dosage for a child who is 67 pounds for medicine measured in milligrams per kilogram. We can find out how many grams are in a tablet based on our knowledge of how many milligrams are in 1 gram. Often in nursing practice, we come across problems such as this, where we are given the prepared amount of the med and we need to find the correct dosage for the patient. So in this problem, if a patient is prescribed 100 milligrams of acetaminophen and it comes prepared as 500 milligrams per 15 ml, we need to find out how many ml we are administering. So we start out with the 100 milligrams that we are given, and then we put 500 milligrams in the bottom, and then we will do 15 milliliters in the top, and that's our knowledge of converting units. We cross-cancel our milligrams, and we are left with 15 ml, which is our desired unit.
With this knowledge, we are able to solve this conversion and know that our answer would be 3 milliliters. This knowledge will help every single day within a clinical setting, and these skills are crucial in nursing practice for safe dosages, correct documentation, and to be without error, and are parallel with biochemistry.
With our knowledge learned in biochemistry of solutions and unit conversions, we can figure out dosages of medications and types of solutions and medications that will help us every day in our nursing practice.